everyone, welcome to Sunrise Extra on a Tuesday. This is our live streaming unscripted after show. So we love our Sunrise Extra family. We are joined by another family member from KGW, Cristin Severance, waking up early with us. Cristin, you have had one of your investigations just take off this week with a lot of people's jaws dropping open at how Oregon health officials are counting COVID-19 deaths in the state. And I want you to kind of give a quick summary of how that works, because if you haven't heard this story, you guys, it's kind of wild. Go ahead.
Sure. I just want to make sure I'm centered here. Yes. So this came in as a verify email. So I do several different, segments and franchises on KGW, and one of them is verify. So people email us and ask, hey, I heard this, is this true? And this man said, I heard from 3 different medical professionals that no matter what you die from in Oregon, if you have COVID, it's marked as a COVID death. So even if it's a motorcycle accident and that person has COVID, that the state would count that in their COVID death count. Mm-hmm. And I thought, this man's probably mistaken. I don't think this is going to be true. Mm-hmm. Well, I reached out to the Oregon Health Authority. No, he was right. So they consider, if you test positive for COVID-19 and you die from any reason within 14 days of testing positive, that's a COVID-19 death. Or if you test positive, you're in the hospital, you're discharged, and you die from anything within 60 days of being discharged, that's a COVID death.
2 months. That's wild.
Yeah, 2 months. Or if your death certificate, says COVID-19 on it. Those are all the ways that they count.
It sounds crazy, right? Because we talked about this, Cristin, on Friday before the story first aired. Are you telling me that if I was diagnosed with COVID and 6 days later was hit by a truck crossing the street and I died, I would be listed as a COVID death? And the answer is yes. And again, I go, how the heck can that be? Now, that's an extreme scenario. The getting hit by a bus or getting hit by a truck or falling off a roof or something crazy like that. But there is a reason why they do it this way. And if you sort of sit back and think about it for a moment, the reason does make a little bit of sense. I'll let you explain it.
Definitely. Absolutely. So, yes, we are talking about the extreme examples here. And when you think of anything in extremes, you're going to think, wait a minute, does that really make sense? But there are several reasons why they do this. So number one, they say COVID-19 can exacerbate any underlying health problem. So if you have diabetes, normally you wouldn't, most people would not die from diabetes. But doctors say if you get COVID, COVID makes you then would die.
It. Uh-huh.
Sure.
Exactly. That's why the whole underlying health issues.
Or even if you fell down the steps, you're going to recover from that, depending on your age and your health. But maybe you suffer some injuries that you can't recover from as well because you have this virus in your system that is breaking you down.
You just don't know. Bottom line is, do not know, how COVID-19 really, really affects any other issue. So that's number one. Number two, they're saying even with the extreme examples that we're bringing up, the falling off a ladder, the motorcycle crash, alcohol poisoning, gunshot wound. They're saying they count that as a COVID-19 death to track the spread of the virus. And they're really sticking by that. They have no plans to change.
So you did an update to your investigation, and we ran it a couple times here this morning, and because you looked into other states, particularly you had highlighted that Colorado used to do this, and then there was so much public outcry because there was a case that a man died of alcohol poisoning. Apparently his family said, and then the state kind of looked and changed their ways. You looked into Washington. What did you find there?
Yeah, so Washington also used to track it the same way Oregon does, and they have a lot more deaths. I mean, they have nearly 1,700 deaths, but they remove the deaths that are not COVID related. They said they want to be as accurate as possible, so they went in and removed, the homicides. There's 3 homicides, 2 death by suicide, and 2 overdose deaths. And they're saying those are clearly not COVID deaths. Right. They should not be in the COVID death count. Colorado, yes, same thing. I mean, our station in Denver, the Tegna station there, KUSA, did a very similar story. It wasn't with a family, it was with a medical examiner said, wait, this person died of alcohol poisoning. Why would the state count it as a COVID death? And people were so mad that the state changed it in a day.
Right.
And and this obviously COVID is so serious. Every doctor in our story will say COVID will kill you. COVID can kill you and could kill you if you get it. This is about transparency. And I asked the doctors in my story, with less than 400 deaths here, which is terrible. You don't want one death.
Right.
But we're not seeing 1,000 cases a day.
Yes.
Like some states are. So with less than 400 deaths, could the state go in and separate the deaths into two categories like Colorado? And the doctor said, yes, absolutely. I mean, the more deaths you have, the harder it gets. But with less than 400 deaths, you could go in and say, this person died from COVID and this person died with COVID.
That's the question.
But you straight up asked them, and you asked them yesterday, and they said they're not going to do it.
I did, because I talked to our reporter in Denver, and because you do that all the time, because I really wanted to look at other states.
Sure.
So, I'm reaching out to a bunch of different stations within our company, and I'm saying, okay, so how does California do it? How does Washington do it? And the reporter in Colorado said, oh yeah, our state changed this in a day. He said, our governor found out and said, no, we need to be accurate here. We need to be transparent. Even if it's, in Colorado, it was 200 deaths that were removed from the list. In Washington, it was just, I think, 7. But even, if you, this whole thing is about transparency, right? So, but no, that is not happening here. No, to answer your question, I asked them yesterday, okay, story happened Friday, blew up, tons of reaction. And, do you stand by this? And the Oregon Health Authority said, we're not going to comment on how Washington does it because we can't, or they're not going to. And we stand by this methodology. And
we've heard from a lot of people who say this totally skews it for me now. When you hear of, because in the, every day we report the numbers, and many people who are dying have underlying health conditions. Are any of those underlying health conditions possibly another cause of death? And are the numbers maybe slightly lower than, the total says? And that makes a difference. I mean, just to kind of distinguish between the two.
I have two
Drew,
thoughts.
Go ahead.
Two thoughts. One, I don't see why, if it's for tracking purposes, couldn't they track it just as easily if there were 2 columns instead of 1? Right now it's 1 column. COVID deaths. Couldn't there be the 1 column died from COVID and died with COVID, and they could still track? I mean, I think that would be a simple solution, but you already asked that question, and right now they say they're not going to change it. They're not going to go that route. But to your point, Nina, this I thought was really interesting in your piece, Cristin. You had the doctor that we use as a resource, and she pointed out that listen, when it comes to tracking number of cases, we are probably way behind the actual number in the area, in the country. In fact, I believe she said we're probably 10 times lower in our numbers when it comes to reporting cases than what is actually out there, what is actually true. So if you think about how inflated the numbers really are compared to what we're reporting, should we be that concerned about whatever the number of deaths is that aren't truly like I died from COVID versus I had COVID and I died? I mean, those numbers don't seem to be as exaggerated as what would be the number of actual cases if we were really able to track everyone who got the virus.
No, you are right. I'm so glad you brought this up. Yes, she did say that. She said for every 1 positive case, there are 10 that are not diagnosed, that are not even tracked. So you are absolutely right. The bottom line with this story is, when there are so many people who don't believe that COVID is serious, unfortunately, no matter how many times you tell them, they're looking for so many things to say, well, see, I don't need to wear a mask. Transparency is so important. Even if it is 5 deaths, 7 deaths, 10, 200, just be transparent. Just be as accurate as you possibly can. Why wouldn't you? Just be upfront.
Right. Okay, so we're getting some comments from people. I'm watching you guys on Twitter, and ND and a bunch of numbers says, how much of this data manipulation leads to the need to increase funding? You know, maybe this is tied to, you know, PPE or federal funds or something. I don't know if you were able to ask that question to anyone with OHA.
Yes, I'm really glad that person brought that up. That is a huge talking point. That's a big, I don't want to say conspiracy theory, but it is. So basically, the thought is people were saying, okay, states want to inflate the numbers, hospitals want to, you know, inflate the numbers because they will get more federal funding per COVID deaths. Well, that argument isn't really relevant in Oregon because the OHA, the Oregon Health Authority, they do not get money. They do not get federal funds per COVID death. And again, we have less than 400 deaths. So you're not seeing this huge inflation. You're not seeing, you know, 12,000 deaths or something a day. And then the other point to that, I do want to mention, you know, some facilities may get some money. They may be reimbursed based on Medicaid, you know, per patient. But again, that's a per facility issue that's not dealing with the Oregon Health, not dealing with the state.
Yeah, I just don't, I mean, this does not help the public perception at all. And I was seeing a lot of people, we've got, you know, over 200 people live watching us. Shireen Miller-Simmons says, I think separating the two is very important to distinguish the actual deaths from COVID, because it is that big headline if you die with COVID or you die from COVID. But are there any kind of like national guidelines that, you know, all of the states have to follow, if you can kind of elaborate on that?
Yes, you guys have some good questions here. Yes, I'm so glad you brought that up because Oregon is not doing anything wrong based on the CDC. I mean, these are they're within the guidelines of CDC. Okay. So is Colorado. Colorado was following these guidelines, and people still said, no, that just is not accurate. We don't want everything lumped together, you know, separate them into two. And so that's what they did. Okay.
You know, the best part, I think, Cristin, of Sunrise Extra is that opportunity to interact with the viewers as they're watching live. This morning, it's kind of crazy. I don't know. I could show you my cell phone where I usually monitor the Facebook live feed and I see all the comments. I have this huge, long, never-ending list, and all it's telling me is literally name by name who's watching. Like literally, it's telling me the name of all the people in the hundreds that are watching us right now, but I can't see any comments. I'm just getting names. There was one option here. It says, Ken is watching you. Bring them on camera. There's like a blue button there that says I can bring someone on camera. Now I'm afraid to hit that. I don't know what will actually happen.
What if they're not camera ready? What if they're not ready?
Right. This is still 7 o'clock in the morning. Some people aren't decent at 7:20ish in the morning. But anyways, I do want to see your comments. I'm hoping that they make their way through the slew of updates I'm getting, just letting me know who's watching. Lots of questions, though. And we can talk about that pushback a little bit, Cristin. Sure, I know we don't have a lot of time with you because there was some pushback on Friday saying, geez, why are you reporting this? Because now you're going to let all those people who think that COVID is not that serious, you're going to give them validation. And they're going to say, yep, I told you, it's not what everyone says it is. What do you have to say to that?
Right. This of course is not that. I mean, as I said on Friday, if any viewer has watched a minute of any KGW newscast since March, you know we take this extremely seriously. I mean, we have shouted it from the rooftops. We have said it, you know, every show on every platform. I mean, every single report we do, COVID-19 is serious. It will kill you. You know, wear a mask. We couldn't be more clear about that. This story is about transparency. I believe being transparent really shuts down those deniers because you're very clear. The numbers are right there. Even if it is, you know, a dozen deaths that shouldn't be on the list, why would you not separate it? Why would you not be transparent? The most accurate you can be.
Yeah, so we posted this story. I do the little Instagram kind of quick newscasts, and people had some great stuff on here. ML Murph says, it totally skews the numbers and it makes me question so much. While I take coronavirus seriously, it does make me question the death tolls in the U.S. How many other states count like we do? And Cristin kind of found out it used to be Washington and Colorado. They have changed that now. Somebody else, go ahead.
Just to answer his question, I am still tracking a lot of the different states, so I'll have more.
Yeah,
I'm checking with a bunch of different
Somebody places, brought up, and I texted you this yesterday, Cristin, because it is a totally like way out there thing to say and hypothetical, but it would be true. if George Floyd had died in Oregon, in his coroner's report, he had coronavirus. And of course, you know, he was killed when the officer kneeled on his neck. That would be listed as a COVID death in Oregon, right?
I mean, based on the Oregon policy, yes. I mean, I went over the extreme examples with the Oregon Health Authority spokesman. I said, you know, motorcycle death. If someone died in a motorcycle crash and they had tested positive 10 days earlier, would they die? And he said, yes.
Yeah.
I think it's safe to say that it would have been listed as a COVID death, technically here in Oregon. That does not mean anyone involved in that death would have been off the hook. I mean, you know, it would be a separation.
Yeah, it just would have been, and I can see, you know, count it as a case, of course. You know, anyone that tests positive.
Count it in the case.
The case rate, you know, is still valid. But yeah, I mean, I think those like outlier.
Nina,
what?
We just talked about at the beginning of this. You don't know how COVID affects someone, so maybe, and I don't want to even bring up that case again that you just mentioned because I don't want to make light of that but if you have someone who's in a situation, my kids are you know, doing something at home and they're wrestling and one is strangling the other, is that, you know, does he suffer?
I'm not talking about George Floyd anymore.
There are some deaths that could be
contributed because your lungs are, compromised with COVID.
Yes.
For sure. But I think the more obvious ones, like, you know.
Yes, you're out hunting with your buddy and he misfires at the deer and hits you instead. Yeah. And now it's a COVID days. That does seem to me to be outlandish. Yeah. In that respect, absolutely.
So how are you following up on this? What are you doing next, Cristin? That's what we want to know.
Oh, this story just has so many legs. I mean, you know, just really I'm focusing on the other states now. On, you know, how they're tracking it, you know, because that is a really good way to see, you know, are we an outlier or, you know, but I have my answer, you know. Yeah. Doctors have told me you can separate this. Now, this is not easy. And Drew, I think you've touched on this with some of your comments. I don't think this is a new virus. Doctors do not know how it affects the body. And that is 100% true. And, you know, health professionals will say, trying to figure out really what was the main cause of death is difficult. And like the state of Washington, you may put a death in that death count. And then once you get additional information, oh, that person did not die from COVID, then you remove it. Yeah. And I think that's very reasonable.
Sadly, Cristin, we are up against the clock this morning. We do have to step aside. We have a live Today Show cut-in that we had to get ready for. It's so strange to me. I cannot see any comments on the Facebook live stream. But for example, Mary Harding Braddock watching us this morning. Good morning, Mary.
It says, nice shout out from Mary.
Well, it says we can bring her on camera. I'm afraid to do so, but Mary, if you want to comment, let me know. Can we bring you on camera? Because I'll hit that button and I'll make it happen next time.
All right, you got to watch Cristin's. She has 2 stories. You can watch them on our KGW YouTube page. They're also right there on our front page of KGW.com. I know you're going to be following up on this for us. Thank you so much for waking up early and joining us and answering some questions. So we will see you guys tomorrow. Be well.